Hi everyone, my name is Adriana and I am here to share my research proposal poster. So, my research question was surrounding which therapeutic modality would be more beneficial for individuals with autism in improving emotional regulation, social skills, and just an overall well being. So the actual one was how does eye movement desensitization and reprocessing EMDR and trauma-focused cognitive behavioral therapy differ in improving emotional regulation, social skills, and overall well-being in individuals with autism spectrum disorder. So I focused mainly on adults, so ages 16 up. And so what I found is that there's literature, all the literature pretty much suggests that trauma in adults with autism spectrum disorder is undertreated. It has been hypothesized that because of the autism experience, so sensory issues, everyday occurrences that can be troubling for them, social confusion, the feeling of masking, incomprehension, and rejection by others can result really in clinical anxiety and then affect the resilience to cope with stressors. So it's really important that clinicians feel comfortable utilizing evidence-based trauma-informed approaches with autistic individuals to better serve a marginalized population. So the majority of the literature that I had found was that people with the diagnosis of autism spectrum disorder also have a lot of co-occurring anxiety and depression, and clinicians don't really know how to respond. And when they find that there's a trauma, when they find that there is depression, when they find that there is anxiety, they are afraid to use trauma informed approaches or trauma treatment because they're worried about exacerbating the situation. So I was really looking for autistic adults' perceptions of their experiences in which they felt increased skills in emotional regulation, social skills, and their overall well being. And unfortunately, it's been very hard to find data working with this population. A lot of the data that's surrounding is surrounding children, and a lot of the data is not um, an autistic person's perception of the experience. So it's been very challenging, but despite the data collected, it has been hypothesized that either of these therapeutic approaches point to promise with the clientele, and there's a couple things that they had mentioned when working with the population. So the clinician who is working with the population has to be well versed in the autistic experience, understand autism, and understand how an autistic person's brain works and how they might be experiencing the world, how they may be experiencing sensory, how they may be experiencing the social world kind of around them, and their communication. They have to be able to understand what that person is communicating, how to communicate with that person, and create like a really positive therapeutic alliance where the person feels understood, accepted, validated, and safe in that environment. So when that happens, a clinician has to be able to adapt the therapeutic modality to fit that individual. So the first thing was that clinicians had to be really well versed in the autistic experience, understanding autism in the population. The next one was that they really had to be well versed in the trauma treatment, so in EMDR or trauma focused cognitive behavioral therapy, to be able to adapt to that individual. They found that when clinicians were not well versed in the treatment, they were kind of rigid in their focus on what they were doing. So when they were too rigid within that, it was not successful for the autistic individual. So what that meant was maybe the communication had to look different. Eye contact didn't have to be. Maybe they wanted to draw out pictures instead of speaking. Maybe there had to be some more check-ins that the individual was okay. There had to be a little bit more sessions surrounding innate coping skills. And the resources that they have available to them before they could get into the EMDR. And then going back and forth really kind of like taking a step back when they need to. And then the third finding was that it was really important to have clinical supervision with individuals who are really well versed in autistic population and adapting the treatment plans for them. So very difficult to find somebody who's really good in all of those. So it was essentially the same between using EMDR and trauma focused cognitive behavioral therapy in having to adapt to the individual. Unfortunately, I did not find a lot of material that compared the two. It appeared that both treatments, depending on an individual's um, environment, how they're seeing the world, and what they feel is beneficial, that supports them. So, this is an important topic. It's very important because individuals who are neurodivergent are working and living in a world that is not built for them, and that alone can be a traumatic experience. Clinicians have to be available to be able to work with this population. It's very important that individuals understand this population. It's very important that individuals understand the experience of this population, and that clinicians can adapt intervention strategies to meet the unique needs of the individuals that they are working with. So, some suggestions would be that social workers are on the front line. They really should be well versed in working with this population. So, I know that Kiyuka has a LGBTQ, working with the LGBTQ population. I do think it would be beneficial for all social workers to have to be able to take competency in trauma informed care and neurodiversity. So, that's just one of the suggestions that I would come with. So I appreciate you taking the time to read and understand my research proposal. Thank you.